Who is a good candidate for a partial knee replacement or a UKR? Patients who undergo a partial knee replacement surgery recover faster than a patient who has undergone a total knee replacement surgery. But who is a good candidate for a partial knee replacement surgery? That's a very, very important question to answer. So friends, in this video, we will understand who is best fitted for a partial knee replacement surgery. Hello friends, I'm Dr. Pankaj Walecha and I'm a hip and knee replacement surgeon in New Delhi, India. You need to fulfill certain criteria before qualifying for a partial knee replacement surgery. And the first most important criteria is that your disease should be limited to only one compartment of the knee. And the other two compartments of the knee must be normal or nearly normal. If only one compartment is involved, then partial knee replacement surgery is going to be a game changer for you. Condition number 2, your ligaments of the knee must be intact. And the important ligament here is the anterior cruciate ligament or ACL. So your ACL, PCL, lateral collateral or LCL and medial collateral or MCL should be intact. In a partial knee replacement, all these ligaments are not touched. Only the worn out part is replaced, and these ligaments give near natural knee movements and feeling after the surgery. Condition number 3, good range of motion around the knee joint. By good knee range of motion, I mean that your knee should be able to extend fully or should become straight, and also it should have a good flexion or bending of the knee. If the knee has stiffness, which means the knee doesn't become fully straight and the knee doesn't bend much, then partial knee replacement surgery is not a good option, because we do not do any soft tissue releases in this surgery and we just go and replace the worn out cartilage. So these patients who have flexible knee yet only one compartment is involved are the best candidates for this surgery. Condition number 4, your body weight should not be very, very high. Typically, BMI less than 40 can qualify for a partial knee replacement surgery. The earlier recommendation was BMI less than 30. If you don't know what is body mass index or BMI, then we are putting a link in the description and you can go and check your BMI and you can see if your body weight is a restriction for you to get a partial knee replacement surgery. And the condition number 5, it is that you have tried and tested and failed all the possible conservative or non-operative treatment options before considering a partial knee replacement surgery. So friends, I hope in this video I was able to give you some understanding of how we choose our patients for a partial knee replacement surgery. And if you still have some doubts, some questions, then you can drop in your question in the comment section or you can share your x-rays with us and we'll be very happy to guide you on the best treatment options for your condition. Thank you so much for watching.